I hope you all enjoyed your session. Unfortunately, we just ran out of time in the middle of me talking in our session. And hopefully I wasn't on mute whilst I was talking as well, because that would have been even worse. So yeah, we had a really interesting session. So we've now just got a few minutes really to, if there's any so feedback from each of those sessions that we could share with the rest of the group. So we're starting with session 1. Lauren, I think, was it Lauren or Roberto? You're going to give us a bit of feedback from that. Any sort of key points that you thought were particularly interesting that came out of the discussions?
Hi, Lauren, would you like to give feedback, or would you like me to?
I'll have a go. So we were discussing the latest project that we're doing at the NDL is going to involve looking at young people and children's mental health and how the COVID-19 pandemic has impacted that. And I think the main kind of priorities or the main things to look at with reference to that would be the kind of feeling of loneliness and isolation, which I think we usually associate with older people, but can also be problems with younger people as well. Whereas about money, especially if the family is already maybe like from an area of deprivation, or the family struggling with money anyway. And I think with young people as well, like worrying about themselves getting ill or their families, especially older relatives or the other friends, etc. So I think, yeah.
Yeah, no.
I think we also had discussions about what kind of organization we should engage with in order to sort of like bring our research into action, and sort of like, and suggestion was sort of a Public Health England, which we sort of like we really usually didn't think about, and the Royal College of Psychiatrists. And yeah, and this sort of like, I think we had a little bit of a discussion about we were obviously sort of like, we need to decide about the priority of research, and we formulated our questions in terms of, do you agree about having this emphasis on mental health and children's mental health in particular? And it was highlighted that actually sort of like we should phrase it as a sort of like just to try to consider it on par of other physical health priorities, and sort of like, and putting all age groups on the same level. And I think something that probably we needed to think about, Ben and all, we have our researchers here in our group, when asked whether we think that actually researching health inequalities would be a good idea to improve population health, most people were actually not particularly convinced. So I think that it's probably some food for thought from our session.
Yeah, sounds like some really useful insights into how we take that project forward. So maybe just, if we haven't got that much time, let's go over to Ken or someone from group 2.
Yeah, thanks, Ben. I'll just kick off with a few points. Yeah, we were looking at the TAF program, which is the reducing physical inactivity and improving physical activity across Pennine, Lancashire, and really trying to understand what the impacts of that program are. But some of the kind of issues that came out were in relation to COVID, and obviously we've seen over the last year changes in behaviour in terms of COVID, because we've had to respond to lockdown. Gyms have been shut, pools have been shut. You know, during the first lockdown, there seemed to be lots and lots more people out on the street, walking and in parks and cycling and stuff. So we've heard kind of 2 different aspects of that, about how it's impacted on communities, you know, communities where it's made it more difficult to be physically active, and then, you know, places where it's actually encouraged people to be more physically active. And we also had a little discussion about, well, now that we're coming out of lockdown 3, since the 12th of April, what's been the impact of that on individuals. I think the final thing that perhaps I wanted to say a little bit about was the impacts of long COVID. One of our contributors made a really good contribution on her personal experience in terms of long COVID and how it's impacted on abilities to be physically active. And I think that, you know, obviously the longer term impacts of long COVID on physical inactivity and personal health, we don't really know what those are yet. We're starting to see some of these emerge in terms of the impacts on the person, but we don't really know what the impacts are going to be overall in terms of the need for services. But certainly, you know, physical activity is a way to kind of improve things a bit. So I think I'd throw it open to all the other people in my group now to add to that if they'd like to.
Anybody have anything else to add to what Ken is saying? I mean, I think it is one of the things that's come up in all the groups, I think, is just how wide the impact of the pandemic is on so many different outcomes. From, you know, we heard from in the first group, children's mental health, you know, physical activity, both, you know, the effect of the sort of lockdown and everything on people's physical activity, but also the kind of repercussions of long COVID that are going to impact on people's ability to be physically active. Just sort of huge consequences, and yeah, potentially some opportunity for doing things differently as we come out of this, that that can help us kind of try and transform some of the ways that we do things that might better kind of build resilience for the future. So I'll just feedback a little bit from the third group, where we were talking about the Preston Community Wealth Initiative. So that is a program in the city of Preston, where they've been trying to develop and influence the local economy so it is more cooperative and more equal, and produces better benefits in terms of well-being and health for the local population. And some of the things that I thought were really interesting that came out of that. And I mean, one was that it's not just about changing some of the sort of specific economic policies. So, you know, things like introducing a living wage and better working conditions in certain employers, that's important. And you know, things like, you know, how big organizations like the NHS spend their money in the local economy, and how they kind of procure things, that's also really important. And all of that has changed a lot in Preston, with a lot more money being invested by those organizations locally. But what is less hard to get a handle on, but probably just as important, is how the sort of values and culture has changed to more cooperative approaches, which is seen as being sort of hugely important, you know, not just in terms of people's material sort of living conditions, but also how they feel and belong, and feel that they are in control, or have a sort of sense of well-being within a place, which those things also seem to be really important for people's health, that we need to capture in this research project. And one of the things that we were talking a bit about was particularly about the care sector, and you know, there's been, again, had a huge impact from the pandemic. Much of sort of care provision is through a sort of private financial model that is quite precarious and doesn't always deliver the best care for people. You know, are there new ways that we could develop those services that are more cooperative, and both deliver better working conditions for the care workers, but also better services for those that are cared for? And you know, are there new ways of doing that as part of this Preston model as we come out of the pandemic? So, yeah, I don't know if from that group, whether Mick or Julian or Jess wanted to say any other things, any key points that came out of that. We've still got 4 minutes, I think, before we get closed down.
I think you've summed it up nicely for me, Ben.
One of the things that you should have mentioned, Ben, is the idea of democracy.
Yeah.
Participating democratically and giving people, therefore, a sense of empowerment and agency, which I think is very much linked to a sense of well-being. So when we say cooperation, it's quite, it's a word to think through quite a fair bit. On the one hand, you've got legally defined cooperative businesses, but of course, there's the whole idea of cooperation as a way of being. And within cooperation as a way of being, there's the idea of equality and democracy. And all of those things come together, whether you're in a cooperative or not. And so the development of, so we're doing a bit of work in Preston at the moment on the development of communities, and we're trying to understand to what extent community values could be identified as cooperative values. Never mind about the legal definition, but there are a series of cooperative values and principles which seem to define how communities naturally behave. And that whole aspect of placing democracy in the community as a whole, communities within communities, and if you envisage Preston City as being the big community, then I think you're working towards a different way of understanding what we mean by social transformation. And that kind of social transformation, in theory at least, can only lead to better health outcomes, public health outcomes, I think.
Yeah, I think that's a hugely important point. And there is a whole load of research showing that where people have more control over the environment, their work environment, and their sort of living environment, which is about democracy, as Julian has said, that does have direct benefits in terms of health outcomes. There's been huge amount of research on that. That hasn't always been applied to this kind of wider, more complex sort of whole place-based kind of change. That has been demonstrated in sort of specific workplaces. So we've just got a couple of minutes left. Are there any final questions before we close the session? But I'd like to really thank all the presenters and everyone for attending. I think it's been a really useful and informative session. As usual, there's always been some sort of technical problems and issues, but everyone has managed to cope with them really well. And thank you all for participating. So I think we will be returning to the main session any moment now. And so I hope you enjoyed the rest of the day.